Demodex mites, Canis. Facts and history. The words Demodex originate from the Greek words demos and dex, meaning woodworm. Currently, there are 65 different species of Demodex mites that find their homes within or near the hair follicles of mammals, including humans, generally in the eyelash area. Demodex mites are considered to be the normal inhabitants of the mammal's skin, though they are considered to be an ectoparasite. Some of these Demodex help to balance the skin's ecosystem by consuming excess skin cells and oils, and in normal numbers they aren't noticeable. When an animal's immune system is compromised, that is when the Demodex mites increase in population and cause distress to the animal. This condition is also known as mange. These mites are thought to be the cause of some cases of rosacea. Demodex canis specifically has been found to manifest themselves on the bodies of the domestic dog, hence their title, Canis. The transfer and infestation of the Demodex canis to humans specifically doesn't typically happen. However, a few rare cases have occurred due to the close proximities and interactions. Cross-infestation between cats and dogs does not occur. The mites live within the hair follicle and sweat glands. They dislike light, so they tend to come out at night, and they can move 8 to 16 millimeters per hour. Demodex mites are cigar-shaped in appearance and have 8 legs. Development of a mite takes 20 to 30 days, which is completed entirely on the host. They can provide an opening in the body through which an infection can travel into the bloodstream. Causes. Demodex canis is considered a common disease in dogs, but most dogs are immune to them and are able to keep their populations under control or eliminate them entirely, naturally by the dog's body. Dogs that have a weak or compromised immune system are most vulnerable to these parasites, like puppies and senior dogs. Puppies may lose their fur around their mouths and faces, known as alopecia. It is not considered to be dangerous to the puppies at this age, and treatment is not necessary, as long as it's less severe to mild. Sometimes the condition is outgrown, referring to when a younger dog develops a mutual relationship with the mite and immunity for later life. Puppies pick up these parasites from the infected mother or skin-to-skin contact when nursing. The mites are not transmitted to the fetus in the womb. Puppies are most prone to this at about 6 months of age and under due to the close contact of the puppy's face to the mother's infected body. Adult dogs that develop a severe case of Demodex mites likely have an underlying issue causing a deficiency in the immune system. These dogs should be tested for other health problems such as cancer or thyroid issues. Senior dogs may exhibit symptoms of the Demodex mites simply due to an aged immune system. Other factors such as environmental or nutrition can contribute to stress, leading to a compromised immune system that allows the mites to overpopulate. Some research indicates that reproductive hormones in female dogs, when pregnant or in heat, contribute to the worsening of the symptoms. Symptoms. Severe cases in which these mites have overpopulated and cause considerable stress are known as mange. The most common symptoms are hair loss, itching, and skin lesions. Hair loss can be localized, which is small white patches, or generalized, which is large areas on the body. Hair loss can occur on the face, legs, body, anywhere there is hair. Skin will be revealed with the hair loss, which can become inflamed, red, or scabby. Bumps similar to pimples or mosquito bites may appear. The animal may bite, scratch, chew itself, or rub itself on furniture to alleviate itself from itching. Bacterial infections from wounds due to scratching can occur. The dog may lose its appetite due to itching and may become lethargic. There may also be a waxy ear infection or an unpleasant odor. An excess amount of oil on the hair and skin may occur. Diagnosis. One method a pet owner can use at home is using the pedal-pena reflex, which may reveal that the dog has mites within or around its ears. This is where the tester will lightly touch the ear and the dog will begin to scratch its ear with its hind leg repetitively. To diagnose, a veterinarian will check the dog's integument, look at the overall body condition, as well as the skin and hair loss. If the Demodex mite infestation is suspected, the vet will take skin scrapings from multiple parts of the dog's body and look at the samples under a microscope. The mites are fairly easily seen under the microscope. Treatments will vary on the age and type of dog being attended to. This can be in the form of shampoos, washes, oils, oral pills, or injections. It is essential for the client to follow a vet's prescription on the amounts and durations of these medications, as they can prove to be dangerously toxic. A veterinarian may recommend the following: isolation, clipping or shaving hair, sulfurated lime mixture or calcium polysulfides used to wash the dog's body, selamectin, a chemical applied to the dog's body once a month so it doesn't wash off, ivermectin, an ingested pill that is taken until the mite populations are within acceptable range, permethrin, topical 0.01 intravesmectin, and oil applied to the skin. Goodwinol is an insecticide ointment approved for treatment. Other treatments including the use of miticides, benzoyl peroxide shampoos, dip solutions containing imerturaz, and other antibiotics. Prevention. The key to prevention in Demodex mites begins with the overall health, as a healthy immune system will help to keep the mites in check. Dogs that are prone to overpopulation of the mites will benefit from regular trips to the vet for a skin scrape in addition to their normal checkups, as well as the vet may be able to offer advice on matters such as nutritional or supplements to further benefit the immune system. It may be advised to isolate the affected dogs and stay away from those you suspect may have an infestation of Demodex mites. Lastly, throw it or thoroughly clean any bedding that mites could be hiding in.
Demodectic mange. Demodectic mange is a skin condition caused by a microscopic mite that lives in the hair follicle. A small number of Demodex mites live in the skin of most dogs without causing any problem. When a dog's immune system is compromised due to illness, parasites, or poor nutrition, Demodex mites can multiply rapidly. It is especially common in young dogs. The overgrowth of mites damages the hair follicle, resulting in hair loss and skin irritation. Signs. The first sign is one or more small patches of hair loss. These can occur anywhere on the body, but the most common areas are the face, ears, and front legs. The skin in these areas may become reddish or crusty, but is not itchy. Most cases of demodectic mange never progress beyond this stage, which is called localized demodecosis. Generalized demodecosis is a more serious condition in which the areas of hair loss and skin injury cover much of the body. Dogs with generalized demodecosis usually have very weak immune systems, so it may take much longer for them to recover. The damaged skin is also very susceptible to infection. Bacteria, yeast, and other microbes that normally exist in the environment can invade the skin and internal tissues. These secondary infections can be serious, even life-threatening. Diagnosis. Although the areas of hair loss may lead the veterinarian to suspect demodectic mange, the final diagnosis is made by performing a skin scraping test. The skin is scraped in several areas to loosen cells and mites, which are then examined microscopically. Large numbers of Demodex mites are seen in most cases. Occasionally, the mites are more difficult to find, requiring repeated testing. Other tests may be performed to make sure the hair loss is not due to a cause other than mites. Treatment. The veterinarian will select the treatment plan based on the condition of the dog and the severity of the skin condition. Treatments may include skin creams, dips, or medications given by mouth or by injection. In cases of generalized mange, antibiotics and other treatments may be required as well. The length of treatment varies depending on the unique ability of each dog to recover. It may range from weeks to months or more. Follow-up skin scraping tests will be performed to confirm full recovery. Because the Demodex mite is normally present on all dogs in small quantities, the condition is not contagious to other pets or to people.